All right. We are on the Life and Health Show. My goodness, we are live and kicking, and we believe that you are also live. Today, we have a very important show, and I'm hoping that you'll make time to stay with us throughout the show. And if you watch it after the live, make sure you also enjoy and let us know what you think. Because today's show is a little more personal to me. We have a video that I posted, and this is a follow up show for that, so we can talk about it. All right, so we can move forward. All right, so what are we talking about today? All right, my goodness, that's what I'm talking about. Yes, we are talking about blood pressure still, but excuse me, but definitely talking about some medications that are going to raise your blood pressure if you do not take care. So, let's start off. All right. So are your pain meds secretly causing your blood pressure to go up? Millions of people rely on common pain relievers like ibuprofen, aspirin, and the rest. But these medications could be putting your heart at risk. That is what we are talking about.
Yeah, so join us today on Life and Health Show as we review the hidden dangers of pain medications and what you can do in order to protect your heart.
Oh, come on, man. What you can do. We're going to tell you the pain medications and also what you can do to protect your heart. So stay tuned, right?
Yeah.
Stay tuned. And if you want to even invite folks, that would even be better. Stay tuned. All right. So, yes.
Yeah, I know you have a personal story regarding this topic, how pain medication affected your grandmother's blood pressure. If you want to share the story with us.
Yes. So, thank you for giving me that opportunity. It is. Oh my God! Yeah, it is something that I take on. Sometimes it makes me a little sad, but that being said, it's a story that I feel like when I share, is going to potentially help other people, you know, use medications safely so that they wouldn't go through what I think I did by participating in something that eventually led to my grandmother's death. So I'm going to tell you the story. And the story is that my my grandma I lived with my grandmother, as I've told you the story over and over again. I lived with my grandmother, and um, my grandmother loved me, and she loved all the other grandkids. But being the only grandson at that point, the rest were ladies, I had a special place in her heart. So my grandmother would send me to buy her stuff, and especially her medications. But at the time, as a kid, what happened was, well, let me backtrack a little bit. So she had arthritis. She was also obese. She was heavy set. To be nice, I should say she was heavy. Potentially, as a grandkid, I think I remember. Now that I'm older, I think she was probably over 300 pounds. And she had.
So we can say, well, morbid, obese.
Yes, but you don't know her height though, so you can't judge quickly.
Okay. Okay.
She was a tall woman.
Okay.
I should say, yeah. So when she had this arthritis, which made it almost impossible for her to basically move around and take care of us, she needed some pain relief. Her arthritis was bothering her, and she was also hypertensive. And that is the thing. So two things. She had severe case of rheumatoid arthritis, and then also high blood pressure, hypertension. So my grandmother would send me out to the drugstore and purchase a medication, which I still remember the name today, believe it or not, all these years later. You want to know the medication?
Oh, yeah.
Oh, come on, man. I'll show you what it is. Yes. So the medication is one that we call Indocin. I mean, at that point, she called it Indocet. I think the Europeans have a brand called Indocet, but she called it Indocet. And I remember very clearly, even now, how she said the name, and she would send me almost every other day to go and get her Indocet for her arthritis pain, while she was also treating her hypertension. And so many, not too many years after that, my grandmother died of complications of hypertension. And I only found out when I was in school, I was in college, that I actually contributed to her demise by, going and being an obedient kid and buying this medication for her. She wanted pain relief, but the pain medication she was using actually made her blood pressure worse. And as I said in the video that I released earlier today, uh, she potentially had some other side effects, some of which we are going to talk about as we move forward on this show, that she wouldn't share with me because I was a kid. But now that I'm older and having been educated with, drugs and medications, I found it so sad that I was part of the group of people, if there were any other people for that matter, who helped die earlier. Because if I had not been buying the medicine or Indocid for her, she would probably live longer because her hypertension would have been easier, to manage. But um, be it as it may, I didn't know. And I'm sorry about that, Grandma, if you are watching.
But I don't know why you feel guilty though, because at that age you had no idea. And I can imagine you seeing your grandmother in pain. And as a child, you don't want your grandmother to suffer. So definitely you would like her to take something that will help her, right?
Right.
So I don't think you should feel guilty. You were just helping her treat her pain condition.
Yeah, but now that I'm thinking about it, I could have done certain things, and she could have also done certain things, which is one of the reasons why this show is very important, right? I don't ever remember my grandmother telling me to ask the pharmacist about the side effects of the medication
Mm-mm.
or how long she should be taking the medications for. We just went and bought them because she needed the pain relief. But in hindsight, I probably should have challenged her and said, Grandma, how long are you going to be on this medication for? At least I should have been a little bit worried as a kid, always walking. In those days, you had to walk a little bit of a distance, maybe. Now, if I look at the house, probably 3 miles
Mm.
just to walk and buy it from the drugstore. I could have been, a bad kid and said, no, I'm not going. I wish I had been like that. That way, she wouldn't get the pain medication all the time and then live longer. It doesn't make sense. That's why.
No, no, because I think if you hadn't gone to buy it for her, she would have called the other grandkids to go buy it for her and called you a bad kid because you are disobeying her. So I think it's more about understanding or having knowledge at that time, which you were too young to know. So it boils down to the fact that information was lacking at that time for both of you to make an informed decision on what kind of medication to take and what other things you could have done differently. Because in her mind, she thinks that's the medication that works for her. So she was going for it because she didn't understand the complications that come from taking that kind of medication. So you were just an obedient child, and I don't think you contributed in one way or other. If you hadn't done it, another child or another grandkid would have done it for her.
But then I
So
wouldn't.
don't feel guilty. I don't think you have to own
I
that.
wouldn't blame myself though. If another kid did, I would have said, I told you I wasn't going. And you pretended you were a good kid and you helped her die early. Don't you think I would have been a little bit off the hook here?
No, I wouldn't think so.
All right. All right. So that brings another important point that I try to hint on, which is one of the reasons why we are doing this show. We never asked the pharmacist. I don't ever remember her asking or talking, even telling her doctor that she was taking that on the side, because it was over the counter at that point. And if I had asked the pharmacist about the side effects, I would have been in a better place to say, Grandma, you can't be taking this for all the time, But I didn't ask, and of course she couldn't walk. She had this joint pain and suffering. She couldn't walk there and ask, and she didn't tell her doctor. So that is why this show is important. What are you taking? And have you asked your pharmacist? Have you asked your doctor how long you should be taking the medication that you're taking? It could even be supplements.
Right.
Have you asked your doctor or your pharmacist how long you should be taking it? Do they even know you are taking that medication?
That's a really
You
good
know,
point. Yeah.
you heard somebody talk to you about it anecdotally, saying that, hey, this medication helped me do this, and you just jumped on it. Or it could be a concoction, some herbal concoction that you have, and you are using it without the knowledge of your pharmacist or your doctor, and you feel you're getting pain relief. Unbeknownst to you, you are raising your blood pressure like crazy. You are destroying your liver. As you're going to go forward, you're going to see how some of these medications we take for pain could actually lead to several bad outcomes, starting with raising your blood pressure, which we are very, cautious about on this channel, or causing even leading to a stroke, which you may not know of. So that is where it is important. So hopefully you can stick with us throughout the entire video. We're just going to mention some of the drugs, and we're going to talk about the side effects and all that. So I think that is something that
So let's talk about the medications that raise blood pressure.
Right? Okay. All right. So let's go from there. Some of the medications that raise blood pressure, and for this show, because of the fact that we're working with time, we picked a huge chunk of a group of medications. I'm pretty sure there are others. I shouldn't say I'm pretty sure there are other medications, but for the sake of time, we're going to stick to one group called the NSAIDs.
Right.
One group called the NSAIDs, and I don't know if you want to.
Yeah, so the NSAIDs is just an acronym, right?
Yeah.
It's NSAIDs, which stand for non-steroidal anti-inflammatory drugs.
Okay.
That's NSAIDs. So if you hear anywhere that people are talking about NSAIDs, it's non-steroidal anti-inflammatory drugs. So let's go over these drugs. Right?
All right. So the first one, which is very common, common over the world. Generic name is called Ibuprofen or Ibuprofen. In some places, they call it Brufen. They have several names for it, but if you look at the ingredient and it says Ibuprofen, that's what we're talking about. In the US, we have two brand names too.
We have the Advil and Motrin.
We have Advil and Motrin. All right.
So if you are taking medication, so as we go over the list, we want you to pay attention so that in case you are taking any of these medications, you have to bring it up to your doctor, especially if you have high blood pressure. So we've mentioned ibuprofen, which is other trade name is Advil or Motrin.
Yes.
And other places they call it Brufen.
And then there's also aspirin. Actually, aspirin is the first NSAID, the first on the list. From aspirin, they developed all the rest. So aspirin, and in the US, we call it Bayer aspirin or, Bufferin. And I'm pretty sure aspirin is a common name throughout the world. But if you have a different name for it in your place where you are watching us from, then just take note that aspirin could also be doing some of the dangers that we're going to talk about. So the two here are the first two on the list of NSAIDs that we are talking about.
Yeah, as pharmacists, I think the aspirin, sometimes they take it off the list, sometimes they add it on. But like you said, it's the first one that they developed all the others. We also have naproxen, right, which is other trade name. We have the Aleve. Some places they have naproxen. So however you pronounce it, just try and know the active ingredient, the generic name, which is naproxen.
Yes.
Yeah.
All right. And the next one is diclofenac.
Right.
Diclofenac also under another trade name called Voltaren or Cataflame. Diclofenac comes also in gels. So you may see Voltaren gel on the shelf. It's the same drug, but in particular, what causes the damage, as we will know later, is the tablet.
Tablet that you take
prescription.
oral. Yes. Okay. Yeah. And we have the endomethacin.
Endomethacin, which is the one that caused the harm in my grandmother's situation.
Indocin.
Yes.
Indocin.
Yes.
But you were saying Indocet.
Yeah, they also call it Indocet.
Okay.
My grandmother called it Indocet from where we were living here.
Well, maybe she was trying to say Indocin.
Yeah, I think there's a trade name in a different country called Indocet too.
Okay.
I could be wrong, but yeah, Indocin is a one that we know, that the brand name called Indocin, and it's also known as Indomedicine. And the next one?
Celecoxib, which is also known as Celebrex.
Celebrex.
Yeah.
Celebrex. And there's another one that was close to Celebrex, which was discontinued, called Vioxx. But we'll talk about it, why it was discontinued. And then there's more.
We have the meloxicam, which is also the Mobic.
Meloxicam or Mobic. And then we have Ketorolac, also under a brand name called Toradol.
We also have a Todolac or Lodine.
Lodine.
Right?
And then this one, I think, is also discontinued, called Piroxicam, at least in the US. If you're watching this from the UK or Europe somewhere, or even Japan, you may still have it under a different name. But in the US, I don't see it anymore. It was called Piroxicam or Feldine. And
we also have Solidac.
Solidac.
Okay. And it's also called Clinaril.
Clinaril. That is also fading out. I don't see them use it as much, but that's another NSAID. And then the next one is Oxaprozin or Daypro.
Daypro.
I like the Daypro name. Come on, man. It sounds so good. It's not Nitro, so it's not. It sounds like it's not going to do you harm, but Daypro, it could be bad.
And we also have Phenoprofen, which is also known as Norphen.
Norphen. And then we have Ketoprofen.
Ketoprofen.
Ketoprofen is also called Uridis or Urivel. I don't see that also as much. I think it's present in some eye drops or eye formulations for pain and inflammation. But for oral or for taken by mouth, I don't see it, at least not in the US. And then
we also have the Flobiprofen.
And that I think that may also
discontinued.
That may have been discontinued. I don't see it anymore. In the maybe within some years ago, I used to see it a lot, but I don't see it anymore. And then there's another one called Nebumetone. This is also commonly used in the US. Nebumetone, also under a brand name called Ralofen. Again, it may be under a different name from where you're reading, calling us from, watching us from. Just make sure that if you take pain medication, look at the active ingredient or the generic name, and you would see.
We also have diflunisal.
Also called Dolobed.
Dolobed.
Right? And this next one I haven't seen ever in my practice. So hopefully it is discontinued or maybe used in a different setting. It's called Telmetane or Telectane. And then
we have the Meclomen.
Meclomen, or in the generic name is what? Meclofenamate. Yeah, the Meclomen, I haven't seen it either.
Yeah.
I haven't seen that. That's probably also being faded out unless it's used in certain specific settings. And then the last one is what we call salsalate or disalcid. I like that name too. Come on, man. Disalcid.
You're dying with acid.
Yes, you're dying with acid, right? And that's what it does too. One of the things it does. All right, let's move forward. So at this point, we're going to be talking about some of the common side effects. We gave you all the list, comprehensive list, some of which have been discontinued. There could be more that we don't have on this market, but it may be available in a different market. And so it may not be all that there is to it. And the other thing is, in some places, they may have, changed the name a little bit just to make it work differently, but it will still be an NSAID. So if you ask your pharmacist or your doctor, is this an NSAID, or is it one of those that can cause an ulcer or high blood pressure or those things? All right. So yes.
Yes. So although these NSAIDs or these pain medications are very effective in treating joint pain, inflammation, fever, they come with various potential side effects.
That's the only thing. My goodness. I wish they did not.
We keep saying that everything that you take, any medication, comes with side effects. So this one is huge. When you are taking something for inflammation, when you are taking something for joint pain, there's so many things that you have to pay attention in order to take it right. So the first side effect that we are going to talk about is a gastrointestinal issue.
Okay, so the GI issues, right? And that comes with a few of them. So we're going to start with the first one being stomach irritation. Now, you may say that, but most medications come with stomach irritation. It's a common side effect with many medications. Yes, this is also a common side effect with the NSAIDs or with the medications that were listed. Could be ibuprofen, aspirin, or any one of those. I'm saying on naproxen, those are the common ones. So if you are taking that, you may have stomach irritation, and that could also lead to something else.
So if you take a long term, can lead to ulcer, stomach ulcer, or intestinal ulcers.
That's the irritation will get worse, and eventually you get ulcer, right? So, and the thing about this medication is, if you are taking and you have had an ulcer before, and it's gone, as soon as you start this, you may introduce the ulcer again. Studies have found that. So, if you had an ulcer, it is gone, and you start taking an NSAID, the chances of you getting the ulcer again is extremely high. Why? Because it's already irritating your stomach, and you had a previous issue with stomach irritation, which led to an ulcer. So chances are that you're going to get an ulcer again. Or, for that matter,
you can also get gastrointestinal bleed. You know, so like you go to the bathroom and you can see blood in your stool. It means that the ulcer, the irritation in your stomach is making your stomach lining bleed. Or break. And this can be seen in your stool. You know, some people, the extreme cases, can vomit blood due to this irritation at the ulcers, which can be a big deal.
Very big, very big, very big. The other thing is indigestion, and this is another one of those common ones that I don't even want us to waste our time on, because, I mean, indigestion is pretty common with most medications, right? If you take a medication and your food you eat doesn't go down much, I don't think it's a big deal. Or even heartburn, it's not a big deal. So, but if that's a big issue, then that it is something that is also associated with this group of medications.
It can also cause heartburn.
Yes, that indigestion and then heartburn is what is good, especially when you use it for a long time. And that's the key here that we want you to take home. Prolonged use. Some of these things, it's not just taking them, but how long. That's why I asked myself, why I didn't ask my grandmother, Grandma, how long are you going to be taking this Indocin? Yeah. You know, I never asked that question. If I had asked, or even asked the pharmacist, potentially I would have known that it should not be taken for too long. But we'll get to them as we move forward. We're going to tell you how they should be taken and the safe ways, and also if you can't even take them at all, what are your options? So don't leave. We got a lot to share.
Yeah. All right, but if the pain has not left you, if you are still in pain, how do you stop taking it?
That's why we're going to talk about some of the other alternatives. Okay. But yeah, so let's finish with the side effects. So now we are on what? Cardiovascular risks or heart issues, right? Okay. And the first side effect under that is what?
Which is the big thing, right? It can increase your blood pressure.
That is the whole point. It's the whole point of the show. Because of what it did to my grandmother, making her die of complications of hypertension. You know, now you can say that, well, most people have hypertension without this medication. Yes, but the people who take these medications on top of their hypertension will have difficulty controlling their blood pressure and may eventually get worse and die from it. That's what happened to my grandmother, and that's where I feel bad. All right, so let's move on. So yes, Gifty said it raises your blood pressure, and
it's also increased the risk of heart attack and stroke.
Also increases the risk of heart attack and stroke.
Over what? Long, prolonged use.
Yes, again, about prolonged use.
And higher doses, right?
Yes, and that's another key thing. So over a prolonged use and also over high amount of dosing. That is where these issues come in. But again, let's move. Actually, before we move forward, let's talk about how they even raise blood pressure. That's the key for our show. So let's just talk about that a little bit. And I would say it's not a lot because we have a lot to cover. Just if you have been watching our show or our channel for a long time, you know we talk about how high blood pressure comes up, right? We have mentioned sodium retention. Sodium retention is one key thing. And one of the things that these group of medications, pain medicines, all right, one of the things they do is they help you withhold sodium. And if you withhold sodium, what happens is that you also have to withhold water. Because our blood has to taste one way. If there's too much salt, we have to add water. That's how easy we have to say it. If you make soup and it's too salty, what do you do, honey?
You add water.
Come on, man.
Lighten it up a little bit.
Yes. You add water just to make sure that the taste is good. And so the taste of our blood has to be one way. And the way to keep it is if you have too much salt, then water has to stay to make the taste constant. Homeostasis, basically. And so if you take these pain medications, you withhold salt. And if you withhold salt, your blood cannot be too salty. You have to withhold water to dilute it out. And that is, once you withhold water, your blood volume will increase. And if you have a higher blood volume and your body is fixed, then what happens is you have high pressure. And that is one key way of this drug or this group of medications leading to high blood pressure.
Yeah, so like in case, let's take for instance that you are eating high content of salt. Okay, to start with, you are eating, your food is so salty. Your food is ready, you sit at the table and you pour more salt in your food. So imagine that you are eating that kinds of foods, right? And on top of it, you are taking these kinds of medications, the NSAIDs. Can you imagine the implications?
Oh my goodness.
Right?
My goodness.
Now you have the salt so much in you, and you are taking medication that will retain this sodium in your body. So your body has a way of getting rid. If you take in water or take potassium or eat other healthy stuff, your body will get rid of the sodium, right? But if you're not eating right, you are eating salty food. And on top of it, you are taking the NSAIDs. You're taking ibuprofen, high doses. You're doing naproxen, high doses. It means that definitely you are going to spike your blood pressure and you are going to be very hypertensive. And if you're taking medication, it's likely that it's not going to be well controlled. So it's like two whammy, right?
Double whammy. Double whammy is working against you. Two things working against
you. So you have to be really careful with your diet and the kind of medications that you take in treating your pain if you have a condition that you need to take medication for.
And the other thing is the same group of medications. All of them cause it. Some of them do it worse than others. But it's fair to say all of them cause it. They also reduce renal perfusion, which basically means that they slow blood flow to your kidneys. And so your kidneys don't get enough blood, and they also affect the kidney function. And one of the ways of maintaining a good, stable blood pressure is if your kidney function is good. Right. Because your kidneys are, like she said, they are going to be the ones to eliminate all the excess salt. All the excess water that you have on board so that your pressure becomes low. So if your kidney function is going to be affected by the same medications, which are helping you to withhold water, so now it's become a triple whammy now, right? Yep. So your kidney function can be touched by taking high doses of this. And if your kidney function becomes less, your blood pressure will naturally go up. Right. Because you cannot excrete excess salt. You cannot excrete or pass out excess urine. So your pressure will always have to stay up. And so, I mean, this is, I stopped taking these group of medications the moment I found out what they can do. I mean, we are going to talk about the other alternatives and, like we said, how you can take them if you have to, because there are certain instances that you may still naturally have to take them. You can't do anything about them. So we're going to show you that as we move forward. All right. So I think we have at least thrown more light on how they cause increases in blood pressure. Again, prolonged use or higher doses, especially for those already at risk, is the one that can cause these cardiovascular events, heart issues, as well as blood pressure, stroke even, because all of them are linked together. Yeah. And there was a group of medications which were actually targeted by the FDA, and some of them I actually mentioned earlier. One we called Bios. If you have been around for a while, there was a product called Bios. People with rheumatoid arthritis, they loved it because you take it and your arthritis pain was gone. Was good. But then they found out that it was causing more incidents of heart attacks. And so they took that off the market just because of this. And that medication belonged to this group. Now, there's one similar to it that is left on the market. But since that recall, providers have taken their time in prescribing it. In fact, most people don't even take it anymore. It's just a few people whose arthritis are so bad that they still have to take the medication. But even that, they are at a lower dose compared to when they actually came out. I remember very well. I was still in pharmacy school when they actually came out. It was crazy. It was just going off the shelf like that because it was a magic bullet for arthritis pain and any kind of inflammatory related pain. But now only Celebrex or Celecoxib is remaining on the market because, again, of their potential for heart problems. So we're not joking here. These medications can be bad if you take them on a higher dose and also over a long period. So I think I alluded to the kidney issues,
Right.
but maybe we can still, you want to talk a
Yeah,
little bit?
so I think you mentioned that already. So this NSAID can reduce blood flow to the kidneys, leading to kidney damage.
Yes.
So not only does it cause ulcers and the production of blood and all that, if you don't take it right,
bleeding. Yeah.
and the bleed, it can also prevent the flow of blood into the kidneys. And that can cause kidney damage.
Kidney damage. And when your kidneys are damaged, the first thing that will show is your pressure
Fluid
will
retention.
go, yes, and your pressure will go out.
Right.
Yeah. And yeah, talking about fluid retention too, they can cause fluid retention by themselves.
Right.
And it makes sense, right? Going by what I said,
Yes.
because they make you withhold salt, and so you will retain fluid.
Right.
Just as simple as that. And for that reason, they will also lead to weight gain. Because if you are not losing your water or fluid, then your weight is going to go up. So, newsflash, you may have been trying to lose weight. All this while, you've been exercising, you've been doing all those good diets, and yet your high dose ibuprofen, you're taking about 800 milligrams of ibuprofen 4 times a day for.
Oh, please.
Come on, man. You are taking it even 3 times a day. That may be keeping your weight up because you can't lose that water. That weight is a water weight because it's got to be there to dilute the salt. That's what we said. And so that's NSAIDs for you. Weight gain working against you. And of course, weight gain is also a prelude.
Increase blood pressure.
blood
And it
pressure.
can also lead to swelling. You
Yes.
can see that you have swells. Your feet are always swollen. That may be because you're taking these kinds of medication, the NSAIDs that we're talking about.
Yeah.
Right. So I think the next one is liver damage, which you also alluded to, right? So
Yes.
it doesn't only attack or affect your kidneys, it also affects your liver. If you take it high doses and not controlled, or you're not taking it the right way,
and over a long period too, right?
it can affect your liver and it can affect your kidneys.
And the one that has been actually noticed to do that a lot is the diclofenac.
Right.
Diclofenac can also cause that a lot. All of them can do at high doses, but liver damage has been associated mostly with diclofenac, which people take for arthritis. A lot of people are taking diclofenac. So if you are taking that, know that is a risk there. It doesn't mean it's going to cause it in everybody. Of course, we are hoping that your doctors will be watching your liver to make sure your liver function, at least liver function tests, to make sure that you are not spiking up liver function numbers.
And also, that's why we sometimes recommend that you don't have to take someone's medication. Somebody went to the doctor, they were given this diclofenac, for pain, for joint pain or for overworked muscle pain and all that. And you are home. Maybe the doctor checked the person's liver function or the blood work. That's why they decided on diclofenac. You are home, you don't know your condition, and because it's there and you have pain, you just go ahead and take that diclofenac. And I know some places it's over the counter. You hear people talking about this kind of medication. Or this one, it works so well. And because you don't know, you just go and buy the same kind of medication, forgetting about the kind of liver or kidneys. You may have conditions, that you are not aware of. Because you just want to take something for pain, this is the first one that you grab. And if you're not careful, you may be damaging your liver or your
That's right.
kidney.
That's right. You may be damaging your liver. You don't want that to be happening to you. And I think we touched on bleeding and clotting disorders too. It touches almost everything.
Yeah.
And suffice to say that NSAIDs, they inhibit platelet function. So, which can cause easy bruising. If you are light skinned and you are on these NSAIDs and you take a lot, you will easily bruise, and everybody can see what are those red patches on your body because of all the bruising that will happen because of platelet inhibition. And
And the clotting, sometimes we don't really see the dangers of these NSAIDs. It clots your blood. So if you have clotting condition and you take it, that's why we said that it can lead to heart attack, right?
so
If you
clotting
take excess,
disorders, yes.
yeah. So it's not something that you play around or just take it whenever there is a little pain. You have headache, and that's the first thing you reach out to.
So they themselves are used to prevent clotting, but then if you don't take care, they will lead to clotting disorders. That's the key here, because we know some people are told to take aspirin 81 milligrams a day to protect against clotting or stroke, which is true. As a matter of fact, there's a new study that is showing that for people potentially over 65, if you don't have a prior history of a heart condition, you potentially don't even need aspirin, because the harm that they are finding in older folks who take aspirin is sort of outweighing the benefits of taking aspirin. In other words, aspirin may be causing more GI bleeds, more rectal bleeds, more ulcers in these older people than they are supposed to protect them against stroke. So if you haven't had a stroke or heart attack before and you are taking aspirin, ask your doctor to see if you actually need to continue to take it. Because new studies are saying that more older folks, people over 60, over 65, are getting bleeds. You go to the restroom and you're bleeding. And that may be due to the aspirin. However small the dose is, that may be due. So if you don't have a risk for heart diseases, you may not necessarily need to take the aspirin, the baby aspirin anymore. But then again, before you make any decision, talk to your doctor. We are not telling you to do this or the other. We want you to discuss it with your doctor and see if it is good for you to continue to take it. Because some people, aspirin has saved them. Had it not been aspirin, they would have had a stroke or heart attack or something because of a clot. But for some people too, it may have done really nothing. They just took it because everybody was saying that it was good.
So because it used to be very popular.
Oh yeah.
Yeah, Dad. I think you did a show on it.
We have a video on our channel about how to take aspirin. Actually, as a matter of fact, now that you bring it up, if you want to know how to take aspirin and take it safely, if you still have to take it, there's a video on the channel. Just search for it, and then you will find it.
Yeah. So I think the idea that everybody should take aspirin this time has been disproved. You have to talk to your doctor first.
Yes.
Because they are saying that the risk may it's not as good as the benefit anymore. Yeah. So.
All right. So I think the last one that we want to talk about these medications is it increases the risk of miscarriage in young women. Not young women. Every woman who's trying to get pregnant, right? Yes.
Yeah, so we know that it's not recommended for pregnant women, especially if you're in your first trimester.
Yes.
Yeah, so if you're not careful, you are pregnant, you are in the first trimester, and you take ibuprofen or you take a leave, you never know. It can cause miscarriage, which I know somebody personally that shared this thing with me, that she had headache, and in the household there was ibuprofen. That was all the pain medication available, and because she wasn't aware of the implication of taking ibuprofen, she decided to take ibuprofen, and she lost the pregnancy because she was in the first trimester. So you just have to be careful, especially if you are in the age, even if you're trying to get pregnant, because sometimes you're pregnant before you know it, before the month
that's the key.
2 months.
My goodness. Yeah. If you are trying to, because you don't want to get miscarriage before you even find out you are pregnant, you know?
Right.
So if you are trying to get pregnant, be careful not to be taking these NSAIDs. As a matter of fact, don't take anything that you don't talk to your doctor about first, or even your pharmacist, especially if you're going to want to get pregnant. So, and I had another thing I was going to ask, but I think I forgot about it. Hopefully, they didn't take aspirin. All right, yeah. So, miscarriage. Oh, yes, I remember now. Now, that being said, the caveat is that some people are told to take aspirin. In fact, they are prescribed the aspirin. I've seen pregnant women who are taking aspirin 2 times a day.
Right.
And the reason is to prevent preeclampsia.
Eclipse, yeah.
So if you are prescribed, aspirin when you are pregnant to protect you against preeclampsia, you have to take it. We are talking about people who are taking in the first trimester, the first 3 months of your pregnancy. That's where the danger is the most. But if at that point your doctor also feels like you have to take it, then it's your doctor that is telling you. Just ask them, you sure about this? Because I know it's the first 3 months. If they are wrong, they will say, okay, hold off until the first trimester is over. But if they really need you to take it, then they will tell you. So if you see a pregnant person taking aspirin, don't say that the doctor or Tens said don't take it. No, you can take aspirin after the first trimester, or if your doctor recommends you to take it, because some people are at risk for pregnancy complications, including preeclampsia. So that's what I wanted to add to that. And I think we're almost done with the side effects. You mentioned the fluid retention, right?
Yes, and edema, right? So,
Yes, Peter, edema, your legs swelling or your feet swelling, and you don't know why. Maybe you are taking some of these pain medications, and in which case, it will lead to fluid retention. Your legs will be raised from filling by fluids.
filling.
All right. All right. So we are going to go to the next item on our program, on our show. And when we come back, we actually want to take a quick break. When we come back, we are going to talk about how to safely take these aspirins or these NSAIDs if you need to. Because for some people, as we said, that's all you got. Your arthritis is so bad. You were sharing a testimony of somebody that told you that if she doesn't take it, she can't go to work, right? So if that is you, how can you take it and still be safe? Or are you even aware there may be some alternatives that may help you? Because if you need pain control, you need pain control. So we're going to be back and we will talk about that. So don't go away. If I were you, I would actually use this occasion to share the stream. We'll be right back. All right, we are back. Yes. We are back on the Life and Health Show. Today's topic, again, it's one that hits home because, as I said, I participated in my own grandmother's death.
You still stand on this? Huh?
I still blame myself because if I had asked the questions of my pharmacist or the doctor, she wouldn't have died earlier than she did.
How old were you at that time, though? How old?
I don't remember. All I know is that
You
I
were
was
pretty young.
no. All I know is that I was buying my grandmother. The fact that I remember the name of the drug tells you I wasn't that Indocin. And my grandmother passed away out of complications of hypertension. And so I'm pretty sure that if I had known better, and I'm happy I went to school in this area so I can tell and help other people. So that being said, actually, if you want to, make time and potentially talk about your medications, I have I'm trying to put on some what do you call it, a QR code that you can actually use to book a call, 15-minute call, and if you feel like you can do it, we can help you. You can do that, and then we will talk, at length. Can potentially even talk about all your medications and see which ones you should talk to your pharmacist or your doctor about. But I'll put a QR code. As a matter of fact, the QR code is on a video that I posted this morning. I did not prepare to bring it on today. I could potentially do it. So if you give me 1 minute, let me just find it right now, and then I will put it somewhere so that, because I'm pretty sure some people may say that I wish I had your number so I could talk about all these medications that I take. And if you are somebody like that, maybe we could help you out. So let me see if I can put this QR code somewhere. Yeah, let's see. Yes. So if you are looking at our screen, from those on YouTube, TikTok, you can't see it. If you are looking at our screen, you see a QR code. You can scan it with another phone or with your whatever camera, and it will be able to give you a link to where you can book a call and we can talk about some stuff and hopefully uh, help you out. So that's the QR code. I wasn't ready to put it on, so I just put it on now. At least you can tell it's covering our whole screen. But yes, you can book a call and we can talk more about your pain meds if you want an in-depth discussion. Right. So with that being said, I think we can go back to our show and continue from where we left off. Right? What did we say we're coming back to again?
How to take it safely.
How to take the NSAIDs safely if you still have to, because we cannot say stop taking your medications. No, for some of you, it's going to be the difference between
you going
to work or you staying in bed because it helps you so much. And we are mentioning the name and you're like, really? Ibuprofen? Really? Paroxycam? Really? Naproxen? Really? Aleve? Really? No, you must be joking. Yeah, I still got to take it. Yes. If you are that person, we're going to show you how to take it and take it safely. And then for the people who say that, oh, okay, if I can't take it, what else can I take? Stay put. We're also going to go into that in detail and give you the options that you may have for pain control apart from this. And with that being said, yes, we can.
And with the pain that we're talking about, we know some people think that they have to take ibuprofen for headaches, So because some pains do not, like, you don't need an NSAID to treat that pain, So there are alternatives. Like you said, we will get to it. But some conditions, you don't really need an NSAID. As we define that to be anti-inflammatory, right? So if your pain, whatever you're having, is not inflamed or it's not at the joints or it's not the arthritis that cause inflammation, you may need a different kind of pain medication than to go straight to the NSAID.
Definitely. All right. So let's go first to the question about how do you take it safely? If I still have to take it, how do I take these NSAIDs safely? All right. So with that, we can start. Right?
Yeah. So you have to use the lowest effective dose for the shortest time.
That's the
lowest effective dose for the shortest time. So let's try and define the shortest time first, right? So we can say that if the pain is so much and you have to take it, you can maybe give yourself 3 to 5 days, and just take it and stop, and the dose sometimes is clearly listed on the bottle that you have to take 2-3 times a day. Some people think that they have to take
3 times a day.
Sometimes it's 1 every 4 hours. Some people will go ahead and, my pain is so bad, I'm going to take 3. So the direction is saying 1. Why do you want to take 3?
Because it's saying it's not working.
No, you've not been taking it yet. You are saying that the pain is so bad, But if you take 1 and repeat it every 4 hours, like what the direction is telling you, you may be able to control the pain than to take it in your own hand. I remember this guy came to my workplace and said, I need ibuprofen. I'm like, you have to make sure you take it as directed. You take it with food. You take it He's like, I don't need food. I'm like, no, you do need food. It states it on there. And you have to take it as directed. He's like, look at me. I'm so tall. And I'm a big guy. And I'm a black, tall man.
You don't need to
I need more for it to work.
It doesn't work like that, bro. It doesn't work like that.
He ended up taking more. And the next time I saw him was looking for Pepsid AC to control the ulcers or the stomach upset. So you don't take matters into your own head and just do what you think you want to do. You have to take the effective dose for the shortest period of time.
And if you actually want to be on the safer side, even if your doctor says take 1, especially they start off like 800 milligrams. That's your beginning dose. You can cut it back to 400. Take a half and
I
see if the
see.
half will work. Will have will work for you. And if it works, stick to the half. It's always be, on the safer side to take less than to take extra. If you take the half and it's not working, then you can potentially go to the full tablet. And that's where we talk about the lowest effective dose. The doctor may not have time to tell you that, start with half, because the pill is, in fact, the manufacturer says take one tablet 3 times a day. So they write take one tablet 3 times a day. But we are telling you that for the fact of the safety issues, take the lowest effective dose. So if the medication starts as 200 milligrams, but you were giving right off the bat, you were giving 800 milligrams, 300, 400, and you feel like this pain is not that much, but the doctor doesn't know. Maybe when you went, you made your face like the world was coming down. So start with the lowest. Those are the two keys we want you to remember. The lowest effective dose for the shortest duration of time. And that will be on the safer side. That will make sure you are on the safer side. So in my grandmother's case, we didn't talk about the dose. And the duration was out of the question. She was going to take it forever because the arthritis was there. It wasn't going anywhere. But if we knew this, we would have asked how long should she take it for. So always ask the questions. And sometimes they may take you to take it for, except for antibiotics, where a prescriber will say take it for 7 days. That one, don't say that, oh, the medications are not safe. For when I took it for 2 days, I was good, so I stopped. No. You can't do that with antibiotics or anti-infectives. Those you have to take it for the duration that the prescription says. But for pain, sometimes it says as needed. One tablet 3 times a day as needed. And as soon as you see the 3 times a day, you take it 3 times a day, even though you don't even have pain. But the prescription was saying as needed. So if you don't need it, you don't take it. So that is not the lowest amount. You are taking it scheduled, even though it says as needed. So if you need it, if the pain is bad and you take it, if the pain is not good, it's not bad, you don't take it. That's what it means there. That way you don't face all those nasty side effects that may come with some of these medications. So that is one technique that we should be thinking about. Taking it for the lowest effective dose for the shortest period of time, if you still have to take your NSAIDs, just so that you will not, find yourself in trouble. Like I was saying, the ibuprofen starts off in the US, starts off with what? 200 milligrams. But your prescription may give you 800 milligrams. You haven't even had the 200 milligrams before. Or if you haven't had 400 before to see if it's going to work. But you go straight up to 800 and endure all the side effects, when you could start with half and still have the pain control and the anti-inflammatory effects that you need. So that is where we are talking.
And you mentioned the as needed. Sometimes too, you take the medication whenever maybe you are going to stay active. Let's say that you have arthritis, right? So you're going to stand on your feet, or you're going to go to work. You're going to be active the whole day. So it's likely that you are going to need that medication. So you take it as needed. You take it that day. But if it's your day off, you are home, that you're going to take it easy that day. You can reduce it, or you can just stop taking it for that day because you feel like you don't really need it that day because you are taking things easy or slow. So the as needed part is very important. In order to take it safely, you have to ask yourself, oh, what is the level? I think here they use the scale to measure the level of your pain. Yeah, so what's the level of my pain today? Is 2 today. I don't think I need medication. I can handle it. I can manage it, So it means that you don't need it. So why are you forcing yourself to take it? That can cause ulcer, can cause affect your kidney, it can affect your liver, and you don't need it. So why do you take it? So we have to really understand the way we take pain medication in order to reduce the number of times we take it. so that it doesn't cause that complications. Yeah.
And the other technique of taking these, if you still have to take it, is to take it with food or milk. So you don't take it on an empty stomach. I think you alluded to that already. So we mentioned the side effect of stomach irritation and GI bleeds and stuff. If you take it with food, it reduces that part of the side effects that is common, with food, with these medications. So you take your ibuprofen or aspirin after you have eaten a meal or after you have taken a glass of milk, or anything like that. Basically, make sure that you eat first before you take these medications.
You buffer your stomach.
Yes, you buffer
so
your stomach.
that you protect the stomach lining. You don't want to cause the wear and tear that will lead to ulcer. Because sometimes, when you're so much in pain, you are in bed, right? You just want a relief. So you get up and you just try to pop 2 pills without eating. You have to take it safely by eating first or drinking a glass of milk.
All right. And the other thing that you can also do to avoid these bad side effects is to not take it with alcohol, because alcohol increases the bleeding effects or this, the gastrointestinal effects that we are talking about, the ulcers that could come, or the liver damage that could come with it. If you're drinking alcohol and you're taking ibuprofen or Motrin, or Aleve or naproxen or Advil, whatever name you call it, Brufen, wherever you're watching us from, then you are definitely you are actually speeding up the rate at which you get these bad side effects, because alcohol by itself is an irritant. It's going to irritate your stomach or your bowels. And then you add on top another thing that also does that. So don't drink alcohol when you take these medications. Avoid them at all costs.
Some people take the alcohol to take the medicine.
Oh, come on, man. Don't ever do that. That is like...
You use water, right, to take the pill.
No, I know what you're saying.
Yeah.
Some people say your booty D or whatever it is, right? But yeah, you don't take alcohol or any alcoholic beverage at all, even wine, because wine has some alcohol with it when you are taking it, because you are going to make it worse for you, especially those who are going to be taking these NSAIDs over a long period, because you're going to be doing it because you have rheumatoid arthritis, and that's the only thing that helps. If you're going to be drinking and then be taking it all the time, I can almost guarantee that you're going to have an incidence of these GI bleeds or an ulcer at some point, especially with an alcohol on board. Come on, man, you're going to get it.
Your grandmother did not drink, right?
She did not drink. And indomedicine is notorious for causing these stomach irritations and ulcers. So I don't know if she had these irritations. She could have been bleeding for all you know, right. But who am I? A little kid, just go by it. She probably wouldn't find it even comfortable telling me about it. And she may not even blame it. She may not know it's coming from
something
the drug.
Else. Yeah.
Yes. Yeah. So that is, and that's why I'm so sad. Come on, man. Okay. Just watch the entire video about my grandmother's case, and hopefully, and share your own. I also put on to share your own comments and what you would have done in my situation. All right, so next one.
You have to stay hydrated.
You have to stay hydrated.
You have to drink a lot of water. So, like we talk about the NSAID inhibiting the flow of blood to the kidneys. So, if you drink a lot of water, it helps with the flow.
Renal perfusion, right?
Yes,
you can get
flow.
Blood flow to the kidneys.
Yeah.
By drinking more water.
Plenty of water.
Good.
So if you know you need this pain medication, water should be your friend.
Water should be your friend.
You have to drink a lot.
You can't take it and say that I don't like water. You got to be drinking water just to clear things out, through your kidneys for you too. That's very good. Especially when you're taking it for a long period. Yeah. The next one is to monitor your blood pressure. You got to monitor your blood pressure if you are going to be on this group of medications, whether it's an aspirin or any one of those. You have to have a blood pressure machine and know what your blood pressure is, so that if it's creeping up, you'll be the first to know before you even alert your doc and say that, hey, doc, I think this ibuprofen, even though it's doing good to my arthritis, is also doing bad to my blood pressure because it's creeping up. And then your medications could be adjusted, just to accommodate it if you still have to take it. And that's one key. Right. If you have to take it and you have hypertension, If there's no other alternative, we're going to be sharing with you some alternatives. But if those alternatives don't help and you still have to fall back on these, you would have to work with your doctor to adjust your blood pressure medication so that it will still be, working out for you with your blood pressure while you still take your NSAIDs. You can take it. That's why I said your doctor has to be in the known. And if he is a good or she's a good doctor, they will make sure that they balance out your blood pressure medication, maybe increase the dose so that the effect of the NSAID will be completely taken out because your blood pressure medication is doing something else to help you out. For example, you are withholding sodium. They can increase your diuretic, maybe put you on something that will make you excrete more sodium easily so that you don't get the fluid retention we're talking about. All right. Anything else?
Yeah, let's go.
All right. So definitely make sure that you are checking your blood pressure at home or regular visit to your doctor. Make sure that your blood pressure is something you are watching carefully and you know that it is good because it can easily creep up as you take these medications over a long period. 1 week may not do anything. That's why we advise that if you are taking them, take them for short periods. But if you are going to be taking them for a long time, then yes. Okay, the next one.
Yeah, so, and sometimes too, a pharmacist may recommend or doctor may recommend that if you are going to be on this medication, maybe you can take your blood pressure first before you start taking the medication.
Just to know.
So you know, and so that you are able to take it only as needed, only the severe cases, because you know that the level is such that it can spike to the dangerous levels. So if it's sometimes the doctor may let you get away with 1 week or 2 week with NSAID if the pain is that bad because they know that your blood pressure is well controlled. So if it's well controlled, they are comfortable to say, oh, take it for a week and stop. So when the doctor says take it for a week and stop, they know that it can creep up. But because it's well controlled, you are safe for taking it. But you have to make sure that you're not going to stay for life. Because if you take it for too long, it's going to cause it to be in the levels that is not safe. So having the monitor machine will give you an idea so that it's not a guesswork here, right? So that you're able to know where it's going. Is it going too high? Should I stop? Should I hold off this day in order to bring down the blood pressure? Yeah, it's very important that you know. And also we have to avoid combining NSAIDs. You will take a leaf and you take ibuprofen. That is not the safest way to go around it. So because we know that a leaf is long acting, and if you take it, it's normally twice a day. So if you take the first dose and the second one is supposed to be repeated in 12
hours approximately, yeah.
If your pain is such that you need something else, you don't have to take another NSAID. You don't have to go for ibuprofen. In that case, you are combining the NSAIDs, which make it very unsafe. So if that happens, the doctor may recommend that then take Tylenol, which is not an NSAID, in order to control your
And you
pain.
can discuss this with your pharmacist. Don't even have to go to the doctor. So it's not like I can't get through. Talk to your pharmacist. Say, I took this in the morning, but the pain is still there. You can tell, okay, if you took an naproxen in the morning and you still have the pain, you can take another naproxen right now, especially at the dose you took it. So now this time take acetaminophen or Tylenol or paracetamol. That way you will be safer in that regard. All right, so don't take multiple of these medications together, especially if you don't know what you're doing. Just make sure you talk to somebody who can direct you to the right way to do it. And the other thing that we can do is to make sure that you consult your doctor if you have any pre-existing conditions. If you have a kidney issue, you have a liver issue, and you're being prescribed pain medication, you have to voice it out. You can't say that, oh, that's a different issue. It is not. The body is one. Make sure that you let them know what you already have. Or you even have hypertension, the doctor has not diagnosed you. You go into the emergency room, they took your pressure. It was good at that point, but they don't know that you've been controlling with some medication. So they put you on a medication, which is also going to raise your blood pressure. And you don't mention to them that you have hypertension, So you always have to advocate yourself. Talk to your doctor about your pre-existing conditions, about your past history of ulcers or bleeding, rectal bleeds, and anything like that, so that when they are prescribing you something, they will be careful not to repeat something that can also cause the same diseases for you.
Yeah, and that comes back to the point I shared earlier, that if somebody is taking medication, you have pre-existing condition, you have other conditions, you just don't want to take anybody's condition because it worked for somebody because of a pre-existing condition. There are certain things that you cannot get away with, like the other person. So you don't share or you don't take someone's medication, and you maybe husband and wife. You don't know because it's in the household. You just grab and take. But you have pre-existing condition. So if you are not sure, talk to your doctor, talk to your pharmacist, so that they know your history and they can recommend a safer medication.
And some of the conditions you definitely have to mention to your doctor about is if you have a heart failure, you have a history of ulcers, as I already mentioned, and you have kidney issues, you definitely make sure you tell your doctors when you are being prescribed a pain medicine. You may not know that they're giving you an NSAID, but if you are looking for a pain medicine for anything, you have to bring these up so that they will make sure
they pick the right,
they give you the pick ones that are safe for you. And the other way you can also protect yourself from unnecessary side effects, especially the GI side effects, to take it with what we call proton pump inhibitors, PPI. So basically, you would take, say, diclofenac. There was actually a formulation that has diclofenac together with, I think it was omeprazole. Right. So a proton pump inhibitor, which is an acid reducer, combined with an NSAID, or so that basically one is counteracting the bad effects of the NSAID or the pain medicine. So you can potentially do it yourself when you're buying it over the counter. If you are buying ibuprofen and you want to be safe, you can say that, hey, since I'm getting ibuprofen, I might as well get omeprazole so that it will counter the GI side effect. That's not going to stop the blood pressure from going up. That's just to protect your stomach lining. So you can still get blood pressure going up. Yes. All right. So unfortunately, I cannot do a co-host on TikTok. I wish we could, but we are on YouTube Live, so we can pay attention to both. So watch us now and send your comment. Hopefully, we can do that next time. All right. So you have anything else to add on that?
Yeah. So you were talking about the combination. I think I've seen naproxen and omeprazole on the shelf. Yeah. So if you have over the counter on the shelf. So like if you have ulcers, if you have GI bleed, that would be a better choice for you.
I wouldn't even go there at all.
Oh, you wouldn't even take?
No. If you have ulcers, don't even try. Just take something else. But we're going to tell people about it.
Okay.
Because it's a risk.
Yeah.
And I don't want to deal with that risk. I mean, that's my personal opinion. You can do it, like you're saying. Yes, you can. But I feel like you shouldn't even try at all, unless absolutely necessary.
Like I'm saying, you don't have any alternative.
If you have no alternative, yes. But hopefully, some of the alternatives that we will share will work for you. Yeah. All right. And do we have anything else?
That's it.
All right. So, with that, I think we are done, right? Oh, there should be another one.
So we are going to take if the alternatives, right?
Yes. So now let's do the alternatives. If you cannot take ibuprofen, I mean, these NSAIDs, if you don't want to take them, you can. But because of what we said, we scared you so much. So you say, you know what? I'm not even going to take these NSAIDs. No more Brufen, no more ibuprofen, no more naproxen. Tell me what else I can take.
Oh, my friend will be like, oh, I don't even want to take medication at all.
Oh, come on, man. That's not what we are saying right now. That's not what we are saying. You can still take your medications. You definitely can take your medications. Remember, we've shown you how to take them even safely if you still have to. If you have rheumatoid arthritis and that's all you can take them safely. We showed you how. But if for some reason you say that, hey, I'm not going to take it, then these are some of the options that may work. And the first one is what we call acetaminophen, or in some places they call it paracetamol. Paracetamol. What's para? Come on, man. Paracetamol, Or in the
Tylenol,
US, we call it Tylenol or Panadol. These
Panadol.
are safer alternatives. That is not to say that they don't have side effects. They have their own side effects, but these don't raise your blood pressure. I mean, everything has side effects, right? But at least for these, you can be sure that your blood pressure is not going to go up. You don't have any heart issues with this, unless it's absolutely so high. Then of course anything else can happen, right? But if you're taking them as recommended, then these are safer for you. There's a caveat though that certain conditions that if you have, you cannot use these medications either, right? So they are effective for mild to moderate pain relief, and they don't reduce inflammation. That's the first caveat. So if you take acetaminophen or paracetamol and your kind of pain is from inflammation, you will get the pain relief, but the inflammation part will not work because it doesn't relieve inflammation. So what is inflammation? Swelling, basically. If you are, especially if you are treating an acute pain, then what inflammation basically means to the layman is swelling. When the place is red and it's bulging out, you hit your head and there's a bump. This will help with the pain, but the swelling will be there. But ibuprofen will take care of the pain and also reduce the swelling. So those are the differences. So that's the only disadvantage. So if you have to take ibuprofen for a week just because of the swelling, that's fine, because you bank your head and you got to get the swelling down and the pain relief down. But if it's not from a swelling or from inflammation, it's not from rheumatoid arthritis, is what? Inflamed condition.
Joint
Muscle. If it's the inflammation part is so much, then you may need something that is anti-inflammatory, which is the NSAIDs. But if it's just the pain that is bothering you, then acetaminophen, 650 milligrams extended release, we call it Tylenol arthritis, right? In our where we live in the US, we call it Tylenol arthritis. That may help with arthritis pain, just for the pain. And you may get away with inflammation, because what is inflammation without pain? It's nothing. If the pain is the real thing that you want to target. So that is where that can be at.
Yes, so in this case, you're targeting mild to moderate.
Yes.
You can get away with the Tylenol, the non-anti-inflammatory, right? It doesn't have the property of working or hitting the inflammation, but at least the edge is taken off. You still
itself.
get relief for taking it. So if your situation is such that you don't have to take the NSAID, take the Tylenol, take the paracetamol. It's way safer. Less irritation to the stomach, and it doesn't spike your blood pressure. You're safe. So if it's something that you can get away, if the pain is mild to moderate, it's not something that is so dire that you need something stronger, do the Tylenol, instead of reaching out for the ibuprofen, especially if you have high blood pressure or if you have heart conditions.
Yes, and the advantages, as I already said, is because the stomach issues are taken out and your blood pressure issues are also taken out. You don't have any of those side effects. The disadvantage though is that if you have a liver problem, you may not want to take this. Well, you could still take it if it's not well advanced. Your dose will be adjusted down. So if you know that you have a liver condition, then you cannot, especially if you are not talking to a pharmacist or a doctor, you cannot take this because it can get it worse at high doses, I should say. So that's the only place where you cannot take it. Or you cannot also take it if you are somebody who is also using alcohol excessively. But that also happens with NSAIDs anyway, right? You can be taking alcohol and taking them. So that is the other one. So there's another way to cheat if you don't want to take the NSAIDs.
I think with the Tylenol, there is a maximum daily dose, right?
It's 4 grams.
4 grams. Yeah. So as long as you don't exceed that, then...
Right, but if you have an issue with your liver, then you may be told to do 2 grams a day.
Lower doses.
Yes.
Yeah. And another caveat too is some of the over-the-counter medication has Tylenol in there.
Yes.
So sometimes you're taking something
Tylenol
for
or
cough.
paracetamol, depending on where you're watching this from. So Tylenol or, as Gifty said, para. paracetamol. In the US, we call it Tylenol.
Tylenol.
Yeah,
Yeah.
either one.
Yeah, so sometimes they mix that with the cough meds and other conditions. So maybe you are coughing so much and you take medication that has the Tylenol in there. If you don't really pay attention, you will end up taking extra Tylenol that you may exceed the maximum dose for the day.
Yeah.
So you have to pay attention to whatever you take. If you're not sure, ask your doctor or ask your pharmacist.
Yes. Yes. All right. So now let's move forward. So yes, the first way is to take acetaminophen instead of these NSAIDs. Now the next one is to use topical creams or gels, which is I think one of the safest because they are rarely absorbed. They are rarely absorbed. I could say that they are basically not because the skin is so intact that they don't penetrate so much and go to your blood. And plus, even if they go to your blood, they would have bypassed the stomach and the intestines where you can cause ulcers or bleeds. They're just straight into your blood. But even that is not a lot. So using the gels or the creams may be your best bet, especially if it's like a knee pain, a back pain, you rub these rubs on there. There's one rub that I like so much called Tiger Balm.
Yeah.
You just massage it into your back, wherever the pain is hot. You have capsaicin. Voltaren is an NSAID, but it's made into a gel, Voltaren gel or diclofenac gel for that matter. And they come in several other brand names. Capsaicin cream, which is like hot pepper. You massage it into the area where the pain is, and you get some pain relief. So you're not taking it by mouth to cause more of the damages that we are actually talking about.
So it works well for muscle pain, right? Arthritis, localized pain.
Yeah.
You lift something and you twist it or something, it's localized. So you just, instead of taking this oral NSAID that can cause the side effect, reach out for the gel. That shouldn't be the first go-to. Try the topicals first, You can do hot water too. The hot patches.
Compress,
Compress just to relax the muscle in the area and you get relief from the pain than just to reach out to ibuprofen or Aleve because you feel muscle pain.
Right.
Yeah.
And that's the to me those are the safest way. If the pain you're treating is localized, like it's a knee pain, put it on the knee, rub it on the knee, massage your knee so much with it and leave it to work a little bit. And they have some innovative products, some icy, you heat it and it's warm and you put it there and you can also put it in the freezer and you freeze and you put it there. Whatever you can use. Some have shoulder pads, everything you can use. It's a local pain where you target the source of the pain itself. If it's a systemic pain, it may not be as good because you need to take pain by mouth. But if it's local, you can point to it. This is it. You put it on and you should get the relief there. And it spares you the agony of having to take these harmful medications when it comes to your blood pressure in particular, right? All right. And,
like you said, sometimes it does not really hit the target because it's not able to penetrate and get to the point. Then in that case, you need something oral.
Yes. In that case, you have to get something oral.
Right.
But there are also other oral pain meds that you can use that are not NSAIDs. But if we want to talk about all those, we won't end today because there's a huge list. But at least for now, we are concentrating on the things that you can easily do and also just on the NSAIDs for now. We can talk about tramadol. Right. It's got its own caveat too. It can also lead to dependence. Or oxycodone, those narcotics can also bring dependence and addiction and all those other problems. So we are going with these simple ones that you can basically do and still be safe. All right, so that is that. And is there any other ones?
Yeah, I think you can do the warm and cold compressors like we mentioned already.
And the patches,
that relaxes the muscles and help relieve the pain. Yes.
All right. The only disadvantage is, again, the other disadvantage is it's for temporary relief. It may not be sufficient for chronic severe pain. Remember, we were talking about mild to moderate pain. But if it's a chronic pain, for example, if you have a cancer pain, that will potentially work.
Right.
You need to take something strong by mouth. So that is the only thing. The other thing we can do to avoid taking these NSAIDs, the other technique is what? Physical therapy. If you do physical therapy, you may avoid using a lot of these pain medications. Some people, all they need to do is have somebody to train them how to use their muscles, to train their muscles to be stronger, and their pain relief may just come. So physical therapy and exercises, that can strengthen your muscles, can make sure that you improve mobility. If you can walk because of pain, if somebody helps you to train your muscles, you may be able to walk and not need pain medicine. So that's where the exercises, muscle exercises, and physical therapy basically come in. And the advantages of that is what?
Yeah, sometimes advantages of what?
Of the physical therapy, like they have long-term benefits.
Oh yeah.
Because you have actually trained your muscles to respond and to do the things you want them to do. And so you basically get the pain relief and it lasts for a long time because you have trained your muscles to do that.
Yeah, sometimes with some people's pain is more like imbalance. The way that they exert one weight on one side, that causes inflammation and pain. So if you have a physical therapist or you go there, they can help you train differently or walk differently or fix that imbalance. By doing that, you're not going to have the pain for you to take the medication, like you're saying, long term. And you're avoiding all these complications from taking excess medication or pain control.
The only disadvantage is that it requires commitment.
And time.
Yes, and time. You got to commit to it. You can, if you don't let somebody help you, well, first of all, you have to be willing to commit, and you also need a professional therapist. You can't just get anybody to do physical therapy. A physical therapist must come to your home or meet you somewhere in their office and show you how to do this. So that it may be a cost attached in terms of time and the cost of paying a professional to do that. But if you're able to do it, it lasts the most. Yeah. So the next one, we are wrapping up. Don't leave yet. Yes. The next one is what?
You can take fish oil, which has anti-inflammatory properties.
Oh, come on, man. Omega-3 fatty acids. Remember last show I told you that it's appearing everywhere. Everything we talk about, fish oil. So omega-3 fatty acids for you because they are what? Anti-inflammatory. And
that can help with your chronic inflammation, particularly in conditions like rheumatoid arthritis, which is ongoing issue that you need solution. So the fish oil can, if you take it or take foods that has that fish oil. I think the salmon that you keep saying, right? And you add the fish oil capsules, that is safer than just taking the NSAID. Sometimes you can take that alongside the NSAID and the frequency may be reduced.
The frequency of you
needing the medication will be reduced because it's in your food and you are taking it orally too. That can help reduce the inflammation in your joints. Yes,
definitely. So fish oil supplements are also in the natural foods like fatty fish or oily fish.
Yes.
Salmon, mackerel, sardines, tilapia, any fish that is fat that has oil, include that. And then chia seeds and walnuts and all those other seeds that also have omega-3 fatty acids. They have good sources of these omega-3 fatty acids. And then if you have chronic pain or rheumatoid arthritis, then talk to your doctor and potentially get higher doses of supplements on top of it. Like Gifty said, it may reduce your need for medications for pain, which is the NSAIDs that you may be dependent on. And the advantage is that they are safe for long-term use, and they provide all these other health benefits that we've been talking about. They will help with your endothelium. Remember, we say they stabilize your blood vessels so that you don't get plaque moving out and causing stroke. They help with the brain development. It's a huge list of things that fish oil or omega-3 fatty acids do. So those are the good benefits. Taking it for inflammation and all those good things. Even for your eye health, everywhere. I think we should start taking that. All right. Well, remember I had some.
Oh yeah,
I
you
just
stopped
ran out.
taking it. I
Yeah,
don't know why.
I ran out, and I'll get another bottle. I'll get another bottle. All right. So the disadvantage though is
Oh, the effect is not immediate.
you
It
have to
takes a
take.
little time for you to see any change at all. So, like, if your pain is such that you need something right away, taking the fish oil is not going to fix the problem
You
right
have to give
away.
it time.
You have to give it time. It builds up easily, slowly for you to
Slowly.
see it.
Yeah.
Yes.
And I've seen people whose joint pain have been helped by taking fish oil, So take your time, but it's gonna help. And the other thing that you can take, aside these NSAIDs is what we call turmeric or curcumin. And
Turmeric.
yeah, turmeric is a natural anti-inflammatory substance, and it also has an antioxidant property. So just like the fish oil
omega 3.
is gonna give you the anti-inflammatory properties that you would get in an NSAID without the bad side effects, right?
Yeah, so I think turmeric, we have it in the health food stores that you can include in your food. You can add it to, some people add it to their tea and all that. And it has the anti-inflammatory
You
properties.
have salads, and they make it into supplements or on the shelf too that you can use. And the advantage is that they can help reduce chronic inflammation and pain without the side effects associated with the NSAIDs, as we have been seeing with the NSAIDs. The only problem, it's got its own problems, right?
So absorption is improved when taken with black pepper.
You have to take black pepper. You have to eat black pepper with it so that it will improve the absorption.
Yeah, and you may require higher doses to see any change. And sometimes you don't get it in the pure state. Some people mix it with other things, so you don't really see the effect. Well,
all right, and I think this may be the last one. The other option aside from NSAIDs that you can use for your pain control is CBDs or cannabinoids. Oh my goodness. CBD cannabidiol. This is the nice way of saying, I'm not going to say it because I pull it back. But suffice to say that cannabinoids or CBDs are derived from what? Weed, as some people call marijuana substance, right? We take these from them, and it's used for a pain relief, and their mode of action is they also reduce inflammation in conditions such as arthritis. So cannabinoids or cannabidiols can be another source. There are pharmacies that deal with them, standalone pharmacies that deal with prescription medications for cannabinoids or cannabidiols. So if your pain is of such a way that you can tolerate with these medications, that would be an option. But I've seen more people with cancer pain that use it more than just regular arthritis. Yes.
yeah, so it's well tolerated and it shows it can reduce pain and inflammation.
Definitely. The only thing is that some research is still ongoing, and the legal status may vary by region. In some places, it is illegal to sell cannabidiol also because I said it's from weed, right? Or from marijuana. Some places they are still not legal to sell them, and so in that case, you don't have access to them unless you do the illegal way, which would be smoking, which is also a whole ball game, a whole different ball game. That's not what we're saying. We're talking about used in medications or formulations that are safer for you. And I think this will be another one.
You can say, okay, so the massage, right?
That's another one that you can use
massage
apart
therapy
from the medication. Massage
and
therapy,
acupuncture.
acupuncture, yes.
Yeah, so it relieves pain, muscle tension, and inflammation in localized area. So if you have a good massage person doing that for you, it's likely that it can help control the pain instead of taking medication.
Come on, man! If you have a wife who can massage, then
If
that's
you
your
have a
pain
husband who
management.
can
Oh,
massage.
come on, man! You put it right back on me. All right, yeah, massage therapy works. After a day's work, some people after they work, a long shift, they come home, And the first thing is eat and take some medicine for pain. You have some medicine right next to you and on bed, and you never used it. That's your wife or your husband. Let them massage you for that back pain. Put some, some oil there, massage you real good, and who knows what will come even after that. Come on, man.
So it can take a lot of time consuming, and
That's
may
a
require multiple
disadvantage.
sessions. So
Yeah,
it's not just one time. Sometimes you have to frequent the place, and it can be very costly too.
yeah. For those paid
Massage
services, right?
therapies,
If you have
yeah.
to go to a
Hmm.
therapist to do that, you know. All right, and it takes time. Yeah, and then the other one is herbal alternatives, which we don't usually encourage because we love herbal medicines if it is studied and it has um, something with it, as far as safety is concerned. But if it is just somebody just concocted something, then we don't believe it. So it has to be studied and the dosing has to be appropriate. And so if you can trust the source also, then herbals like ginger, you can use ginger for pain, something called boswellia,
Boswellia.
and then also white willow bark. All those are things you can use, and there's countless others that other people know that we don't know. But suffice to say that they have to be from a trusted source. And if you are taking any herbals, make sure that you tell your pharmacist or your doctor because they may cause drug interactions and other severe outcomes that you don't know, like touching your liver or your kidneys. We can't say that enough. So we are not really a fan, but we'll have to mention it because some people have obtained pain relief from herbals if you do it right and you're on the right dose, on a safer dose. Yes. Right? All right. I think we potentially are done on there. We have some comments before we leave. We can go through. We have somebody with a comment here. See if my comment show will come and see if we can read it. So Daniel Ampofo. Oh, thank you for commenting. We don't even know what you said this, but just before once you are on, let's read your comments. Say, watching you live from Dallas, Texas. Great education. Thank you all so much for these important education. Oh, come on, Daniel. We appreciate that. My goodness. That is good. That is good. Thank you, thank you, thank you so much for letting us know that you are watching from Dallas, Texas. It means a lot to us. And if you are watching and you didn't say anything, I want to say that there's still time. We're about to wrap up, but you can share with us. Those on TikTok, you can also follow. If you didn't follow yet, come on, man, follow. My goodness, you don't hear my sound effect if you're on TikTok. Make sure you go to our YouTube channel and also subscribe, and you will see the full show on there. I think with that being said, I'm not sure if we have anything else to um, say. Let's see what
Okay,
we
that's
have
it.
here. That's it. So that was the last one that we actually had in play for our show. So now, before we close our door, back to my grandmother's story. That's the whole reason for this show. Because you may be unknowingly participating in the demise of your loved one by giving them something you don't know. Just because somebody said this medication works doesn't mean it works for them also. Or that just because your wife, your husband, your grandparent, your uncle, your sister, your cousin wants that medication doesn't mean that it is safe for them. If I had known that what my grandmother was making me buy for her was eventually going to make her die of complications of hypertension, I would have said, "No, grandma, I'm not going to buy it anymore." But I just unknowingly participated
That's it.
by just being obedient. So yes, you may be an obedient person just because you are helping them out. You're trying to make sure that your loved one is not suffering, or even yourself. You don't want to go through pain, so you just want to take whatever it is out there that people are recommending to you. But the question is, have you run it by any expert? Do you know what else that may be causing? You may be getting the pain relief, all right, But what about your kidneys? Are they standing out well? What about your liver? Are they going to hold on after some time of taking this? And why should you be taking something forever when it potentially was just prescribed for you for a week? Because it's good, it was good for that week. Every time you need the pain control, you say, oh, when I was sick, that's what I took. And you go, you buy it. That's not what it is. So don't be an unwilling participant in your own health demise, and especially for your blood pressure. Don't let that blood pressure go sky high and cause a stroke or heart attack just because you're trying to do well by controlling your pain. So that's what I have to say. And I hope that with this show, you have enough information to at least, if not all, to think about some of the things that you can do differently and ensure that you have safe medication use and protect yourself and your heart from getting touched. Have anything else to say?
Yeah, and also I would add that some people, because have they have access to medication, their chance of abusing it is so high. If you are in a country that you can buy whatever or whenever because you can afford it, you have to be really careful because you don't know. You have to really understand or ask a professional before you start taking any medication because it may be causing harm, more harm than good.
More harm than good.
More harm than good. So you have to really consult, ask questions. And like you're saying, if you are buying it for your loved one, you have to ask, do you need it all the time? Is it something that you can control for just because you are not doing the extraneous exercise or work? Is it something that you can manage with something else other than taking that medication because it's so easily accessible? And also, some people can buy 500 container of ibuprofen. And whenever they have
headache,
they take it. Whenever they feel discomfort, they take it. You have to be careful. It may be affecting your blood pressure and your weight and other things that you may not be aware of.
Definitely. And I told you in the beginning, I don't take ibuprofen for headache anymore. I don't take any NSAIDs for headache. My first go-to will be acetaminophen or Tylenol or paracetamol or para, as Gifty said. Now, if that doesn't do well with my headache, then I'll begin to ask the questions, what is going on? And maybe if you can see your doctor if you have to, but that should be not a first. Taking the ibuprofen or brufen should not be for those things. No, you should not. Even if it's been working for you, yes, I know, but it may be causing GI bleeds. You don't know why small things you are bleeding from, your rectum, or you have this thing that doesn't work out. Your weight is still up there. Your kidneys, you don't know how they are functioning. Let's get ourselves off of these NSAIDs. Pain control, if you are using these NSAIDs, should be for a maximum, like Gifty said, 3 to 7 days. You should stop. As a matter of fact, the FDA wants you to be using pain medicine for tops, I think it's 7 days.
7 days.
Yes. And if you have, some insurance companies will not even pay for your pain medicines if you are using it for more than 7 days. Your doctor has to call them and explain why you should still need pain control after 7 days. That should tell you that it is not safe to be taking it beyond 7 days. If you need it for 7 days, then some of the options that we showed you should be where you have to go through. You may also need to just lose weight. If you lose weight, we're talking about this and we say losing weight is not that easy. But for the long term, if your pain is on your knee, maybe begin to think, if you weighed a little less, how much less pressure will be taken off? How much more pressure will be taken off of your knees and make you need less pain medication. Your back, you're a woman, you have a big bust, you have a big back, weight everywhere. So your knees are not standing the pressure. They are not able to stand the pressure of all the weight bearing on them. But you just go and you take ibuprofen or brufen on top of it, or naproxen on top. You are increasing the weight even more. Those things must stop. Think about how you eat right and keep watching. Subscribe to the channel. Follow us wherever you're watching us from. And let's work together to bring our weight down. Now, if you want an in-depth talk, plans and stuff, go back to the video, scan the QR code, and see what we can do. We also talk about money, financial issues, because we believe in the total well-being of the human being. So if you scan the code, you have access to whichever one you want to talk to us about, and we will hopefully make an appointment and talk to you in depth. But we want to say thank you for watching. Put more
And
questions and sharing, and put your comments on top whatever time you watch. I know we did this show late, so most people may be sleeping now. But whenever you watch it, make sure you add your voice. And thank you to Daniel Ampofo for his beautiful comment from Texas. Thank you so much. So, with that saying that, we will say, Beloved,
we wish above all things that you prosper and be in health, even as your soul prospers.
Even as your soul prospers. As I look for my button to end. God bless you and thanks for watching.
Thank you for watching.
Thank you.